The following is a Carter Media production by CarterPod. Hey everybody, Drew Tully here, and I'm excited to help launch Carter Media's podcast platform, CarterPod. We kick things off today with episode number 1 of our featured business podcast. Chris Brown, the CEO of Shirkey Hospice and Palliative Care, is in studio to give us an inside look of what hospice and palliative care is. With that, let's go ahead and bring in our guest, Chris Brown. Chris, thanks for stopping in today. Looking forward to learning about hospice and palliative care.
Well, thank you for having me.
And can you start by telling us what hospice care is?
Basically, hospice is a care for end of life. So if you or someone in your family has a terminal diagnosis and they have decided to stop curative treatment, at that point you would be eligible for hospice care. Medicare is a Medicare beneficiary. All hospice Medicare beneficiaries have this available to them. Most insurance companies, if you have a MA plan, Medicare Advantage plan, you'll either convert back to standard Medicare or they'll cover it themselves, and it's also covered by Medicaid.
And what's the difference between hospice and palliative care?
They both are really the same. Hospice is the formal program that is recognized by the government. Palliative refers to bring comfort. So obviously that's our main goal for someone who has a terminal diagnosis, is we want to bring them comfort. We do offer a palliative program, and that's for those who are still seeking a curative treatment, but want an intermediary between them and their providers to help coordinate care. But unfortunately, Medicare, doesn't have a program strictly for palliative. It is something some hospices do just to help the patients. Again, to qualify for Medicare to pay for it, and most insurances, the government says you have to have a terminal diagnosis that if it runs its normal course and you're not seeking curative treatment, that you would pass within 6 months. Now, no one can know exactly when someone's going to pass. Only God knows that. So, we've had patients on for 2 years and longer. And I give a lot of credit to Jimmy Carter, former President Carter, who went on hospice. He and his wife both did. And they helped bring hospice to the forefront, and he was on for over 2 years. So, that 6-month guideline that Medicare has is just that, it's a guideline. The government allows us to do a recertification process every 60 to 90 days. So, the person can stay on as long as they qualify, as long as they need the service.
And you mentioned the qualifications for insurance and Medicare. Are there any other qualifications for hospice care in general that are required?
You just have to give up curative treatment. Let's say you have cancer, you would not be able to continue to receive chemo unless it's for a specific reason like pain control. But you can't do anything that's curative. And most people that call us that we have on service, they started out trying different treatments, or chemo or radiation or whatever the case may be, and it has not been successful. And, they're like, I'm to the point now where I'm more about the quality of the time I have than the quantity. And that's where we come in. We treat the symptoms of whatever disease they have. There's many disease processes. Cancer is the number one, but liver failure, renal failure, pulmonary, heart, end-stage Alzheimer's. There's all different types of disease processes that take people's lives every day. So Medicare, covers all those with specifications, and basically it's a huge relief for families because it costs them nothing. This is the one thing that there's not an 80-20 split on as far as hospitalizations or other types of Medicare payments. Medicare will pay for a whole team, and that's what you get with hospice, is a team of physicians, nurses, social workers, and chaplains. And we have all those available, and we do a plan of care to where we know what the patient wants, and also educate the family. This is what the person's going to go through. This is why we use this medication or that medication. We're going to cover every medication that they have that's related to their terminal diagnosis. We're going to provide any medical equipment they need free of charge. The family, the patients are not charged for this. The social worker comes in, and if they need help with setting up powers of attorney or other things involving paperwork, or if there's family dynamics that need a social worker or possibly the chaplain. Obviously we have 2 chaplains, and a lot of people have their own pastors that they utilize, but many don't, and our chaplains have been a great resource for the patients and the families as well.
When you mentioned all the services that hospice offers and the different members of the team, will they go into someone's home?
Yeah, we go to wherever they call home. So if they're in their traditional home, we go there, apartment, wherever it may be, or we can go into nursing homes or assisted living facilities. Wherever the patient is at, we come to them.
Yeah, I know you mentioned earlier you never know how long someone may need hospice, but is there any sort of time limit that you have to be under to be on hospice?
No, as long as you continue to qualify and that's certified by the physician or a physician extender like a nurse practitioner, as long as they certify that you meet the criteria, you can remain on.
Is there a difference between for-profit hospices and non-for-profit hospices?
I've only, my hospice, Shirkey Hospice, is a nonprofit 501c3. So I know we do more than for-profit hospices do, simply because the money doesn't go to some corporate office. It stays right here with our offices. We have 2 offices, one in Richmond and one in Carrollton. So, I'm able to run more staff than a for-profit hospice would, and I'm also able to do more visits. So most hospices, you'll get an aide, a CNA that comes into the home with help with bathing and certain ADL cares. They do it 2 times a week. We do it 3 times a week. So that's just one example. Another thing we do that most hospices don't is called our bedside vigil program. And that is where when your loved one is actively dying, actively passing, we put an RN or an LPN will come and sit with them bedside, making sure their symptoms are controlled, that they're not in pain, that the family's questions are being answered about, why are they making this sound or why are they acting this way, to keep them, to reassure them that this is part of the dying process and they're not in pain. So that we've had tremendous feedback on that particular component alone, how much families have just loved us being there and taking that burden off the family.
And for listeners or viewers that may have a loved one or a family member that could need hospice sooner rather than later, is there a time that's too early to call, or when should they?
No, it's, once the family or the patient, I should say, makes the decision that they no longer want to do the curative route and go through the pain of that, I recommend families call us immediately. The financial savings they're going to have with us taking over paying for a lot of the medications and all the equipment and just, the extra care they're going to get from the nurses' aides, the nurses, the social worker, the whole team coming out and helping to take some of that burden off them makes a huge difference, not only for the patient, but for the caregivers. And, we see a lot of caregiver burnout. People get tired after taking care of someone for so long, mentally and physically, that just being able to have a team come in and help you to do that bath, to help fix a meal if you need it, to do whatever you need so that you can get away and take a break, that's so important. So I would recommend families call us as soon as possible so we can get your loved one on service and start getting these benefits. The one comment we get from families is, we wish we had called you sooner.
I understand you have a program called the What If program. Tell us about what exactly that is.
That is a program we have where we try to grant a last wish to a patient. And, if it's physically feasible, we will try everything in our hearts to make it happen. We've done everything from carriage rides, The most recent one we did last summer is we had a patient who had ALS, and he wanted to skydive. He had never done that before. And we were able to make that happen, and he was very nervous about doing it but wanted to do it. So we had it all set up, and we surprised him. His case manager, his nurse, jumped with him, and that just meant so much to him. So we have a lot of photos and video of the two of them landing from skydiving, doing a tandem jump. But we try to do whatever we can to fulfill a last wish, whether it's bringing family members together or taking them somewhere, or whatever we can do. If it's realistic, we will try to do it.
If any listeners or viewers want to find out more information about Shirkey Hospice or hospice care in general, what's the best way to do that?
You can call us at 660-542-1679, extension 1 for the Richmond office or extension 2 for the Carrollton office. The Carrollton office covers Carroll County, Livingston County, Lynn County, and Sheridan County. And the Richmond office covers, obviously, Ray County, Lafayette County, the eastern side of Clay County, and then the county right north of Ray County. Caldwell County, thank you. Caldwell County. So we have 8 counties, 7 counties and a partial one that we cover. Basically, we go as far as Excelsior Springs to the west. We go up to Hamilton to the north, all the way to Keatsville to the east, and to the south we go Concordia, Lexington, all along that Route 24.
Thanks everyone for tuning in. If you enjoyed this episode, be sure to subscribe to CarterPod on YouTube and follow us on social media. We'll have more upcoming episodes of the Featured Business Podcast and the launch of more future CarterPod podcasts. If you're listening on the go, you can also watch the video version on kmzu.com on the CarterPod tab or the CarterPod YouTube channel. If you're watching the video version and want to listen on the go, be sure to listen wherever you find your podcasts.